All right. Hi, everyone. Um, we'll start now, and there'll probably be a few people joining in the next little bit. But welcome to the Summer Lunch and Learn series, which is a partnership between the Institute for Circumpolar Health Research and Hotıì ts'eeda. My name's Sophie Rohr, and I'm a research scientist at the Institute for Circumpolar Health Research. We're all meeting virtually today, and so I'd encourage you to write in the chat where you're joining from. And today I'm speaking to you all today from the traditional territories of the Kwalindun First Nation and the Ta'anquichin Council in Whitehorse, Yukon. This Summer Lunch and Learn series is designed to spark conversation, connection, and knowledge sharing amongst community members, researchers, practitioners, and policymakers working across the North. And as I mentioned, it's co-hosted by the Institute for Circumpolar Health Research and Hotıì ts'eeda. The ICHR, or Institute for Circumpolar Health Research, is an independent, not-for-profit organization based in Yellowknife, Northwest Territories, devoted to advancing health research and education in circumpolar regions. Our vision is to build on the strengths and knowledge of all cultures to achieve health, and our mission is to foster partnerships for the development of Northern health knowledge through research facilitation, education, and knowledge synthesis. And we're very excited to be partnering with Hotıì ts'eeda, which is a research support unit hosted by the Klitschko government and governed primarily by the Northwest Territories Indigenous governments. Hotıì ts'eeda connects Northwest Territories organizations and communities with researchers and funding to achieve health research and training goals, and it's funded by the Canadian Institutes for Health Research. It's my pleasure to be moderating today's seminar, and today's speakers are Kyla Wright and Rob Warburton. Kyla and Rob, thank you so much for taking the time to be here and share the work that you're taking part in about your trip to Helsinki. Before we begin, there's a few housekeeping notes. We'll be recording the session for internal use, but it's possible that it may be published publicly at a later date. We invite you to keep your cameras on at all times if you're able. Kyla and Rob will share for about 40 minutes, and then we'll leave time at the end for questions and discussion. You're welcome to drop your questions into the Zoom chat at any time or raise your hand during the Q&A. We really want to encourage discussion and active participation. It's really intended to be a space for learning together. So now it's my pleasure to introduce our speakers, Kyla and Rob. Kyla Wright is a health system strategist co-leading primary healthcare reform efforts in the Northwest Territories. As the manager for systemic design and integration, she works with multidisciplinary teams to design, implement, and evaluate change towards a culturally safe and anti-racist health and social services system using relational design principles, community-based research, and quality improvement. Her roles as a naturopathic doctor and emerging researcher provide ongoing learning and grounding in the experiences of patients. She is currently completing her MSc in Public Health Sciences with a focus on the gendered and intersectional impacts of climate emergencies and perinatal health system resilience. Having been born and raised as a settler guest in the Northwest Territories, she's grateful to continue to learn about the importance of land-based activities as part of health and wellness. She currently raises her family, including 2 active children on Chief Dry Geese territory of the Yellowknife Dene First Nation and North Slave Métis. And Councillor Rob Warburton is a dedicated community builder and social entrepreneur with a focus on fostering sustainable real estate development, business incubation, and local empowerment. As the founder of Outpost, a company that specializes in co-working, residential, and commercial real estate, Rob works closely with small businesses, NGOs, and community organizations to identify spaces that foster growth and collaboration. He's deeply committed to providing mentorship and support to local entrepreneurs, helping them navigate challenges and scale their businesses while contributing to the broader community's success. In addition to his work at Outpost, Rob serves as on the Yellowknife City Council, where he actively advocates for long-term community-centered policies, practical housing solutions, and local business development. He was a founding partner of the Yellowknife Car Share Co-op and the Yellowknife Climbing Club and has served on various boards, including the City of Yellowknife's Community Advisory Board on Homelessness and as past president of the Yellowknife Chamber of Commerce. So I'll leave it to Rob and Kyla to present about healthy cities, and you can both kind of take it away.
Awesome. Thank you very much. Kyla, you can fire it up. Awesome. Thank you, folks. Thank you for having us. Rob Warburton. I'm also joined by one of our other members on that trip, Becca Denley, and one of the folks that kind of quarterbacked it all and kind of got it organized and put together. So thanks, Becca, for joining as well. Yeah, we're basically going to talk about healthy cities, lessons learned from Helsinki, rough outline of our project, and kind of the goal. So we're going to do background and context of the healthy cities, grant, kind of what we're looking to do and explore, go over quickly over the Helsinki study tour, basically what we learned, and kind of how that can be contextualized here in Northwest Territories. We love to say we're unique and special, and what Helsinki showed us is that there's a lot of ways that we are not. There's things that we can bring over that will work great here. So, and then most importantly, in the end, is to see some feedback, kind of interest in folks going forward to help us kind of inform the project. So this is Kyla's, so she's gonna correct this. So to get started, you can either scan the QR code, put in the code, and we're looking for, what do you think a healthy city is? What comes to mind? Very vague on purpose. So give a few minutes for that to populate for folks that are up for that. Oh, there we go. Perfect. Glad I wear my glasses so I can read those. They're getting smaller. Awesome. Okay. So yes. So I think I'll read that. Not very shocking, but green spaces a few times, different kind of green spaces, walkable, bikeable, community public spaces, accessible. Yeah, these are all themes that we saw on our trip, and we're kind of really want to focus on a number of these things during our process of our project. Kid focused, clean air, environmentally focused. Yeah, great. Thank you, folks. Excellent. This is the team. This is the folks I had the privilege of joining. Susan Chatwood, who many of you folks know, along with Becca Denley, quarterbacked the application, hustled us all to organize ourselves and free our schedules up, and it was a tight timeline. Yellowknife, I do believe, actually applied, didn't make the initial cut, and then a city dropped out, so we were asked to join, but it was relatively last minute. So thank you to all the team members here. Thompson is a physician in town and works with the Arctic Indigenous Wellness Foundation. Myself, where I spelled my name wrong and then my own slide deck. Kyla, who's a doctor we've met already, and then Annika, who's not in this photo. She came on as well as research assistant, and she did some trips farther north. While we all were in Helsinki, she went north and checked out like snow removal equipment and all kinds of really weedy things that we tasked her with, which was wonderful. So project questions. Basically, we're looking to see how can we design a community for people, make it more equitable and mobile. Active transportation is a big old catchphrase everybody uses that can be sliced a million ways. That's what we're looking for, is how do we make a city more equitable and accessible for folks to use. Want to go to Helsinki and see what their policies and practices were, like how do they support folks, and we'll get into later, but it's a very different lens how they approach active transportation. Here we go very infrastructure heavy. There it's a little more holistic which I found very interesting. And basically, how can you contribute to the future community planning of the city of Yellowknife? So the city has an upcoming transportation master plan. Basically, as many governments, we have done many studies and many plans and many great ideas, which then we've half implemented or sort of done, and then they get shelved. And it's in silos. So the infrastructure folks at the city are not talking to the planning folks in the way that we need them to. So this transportation master plan, which is currently in process at the city of Yellowknife, is going to have public consultation and chances to have lots of input. And this was the goal. One of the main goals is try to inform that in a real way. So that plan, the direction of council on that was it needs to integrate everything from street design to multi-use paths to biking infrastructure, how are we replacing water and sewer lines, like all these things, policies and planning, policies and economic development. So all into this one central location for hopefully the last plan I got to talk about active transportation for a very long time. I don't like planning, I like doing. So that is the goal, is to inform that key document so we can kind of direct physically how the city builds out in the future, as well as policies and processes. So, and then Susan and Becca put in that package, and we're really going to focus on active transportation in public spaces is the main focus, but we'll touch on all those other things as well because it's kind of a holistic approach. And then roughly this year into next year, I don't think that active transportation plan or master plan is going to be completely finished this year. So we have some timelines we're going to try to hit here and engage folks to input into that plan. I love this phrase, Becca, thank you. This is not just about bikes. When folks think about active transportation, they always think about just biking. And really it's not. It's about all the ways that we can be active and affect health in our city. Not the default mode, and I can tell you from the past 2 years of reading many, many budgets and reports, the default mode is cars. That is the default for designing and doing everything we do in our city, and that needs to change. We can't impact our health and our outcomes of our residents if we're all sitting in a car all day. So it's not designing cars away, it's not anti-car, it's just including everyone else. So one of our fellow councilors, Ben Hendrickson, he's a big bike advocate, he's also the mayor. He dug up some stats that about 30% of our city does not have access to or uses a car. So when we design an entire city and community around a car, we are leaving out a third of our residents. That includes children, that includes elderly, people that aren't as mobile. So we have an accessibility plan, which is more geared towards, doors and ramps and those kind of things, but we still aren't designing a city yet for everyone. So that is the goal. So it's not just bikes, it's everybody, so they can get around their city safely. The city does, as part of that mesh transportation plan and as part of our project, we really do want to make sure we integrate Indigenous-led design and make sure everything is culturally appropriate. We there's a bit, whenever we do reports or studies at the city, historically there's been, consultation with Indigenous governments, which has been very low in the past, to be frank. So we've put particular effort and time and funds behind making sure that there is space for that in that plan, and also in our project, we want to ensure that we're purposely making sure those voices are heard when we talk about urban spaces and how they're designed. And public health is bigger than just many of you folks work in that industry. Cities don't often think about public health. We think of that as another level of government's problem, but we want to make sure this is integrated into our public policy and planning because it's incumbent on all of us to make sure that works well.
Amazing, thanks, Rob. And yeah, just to add, we know that this work is connected beyond to public health and climate change, and so has implications for a lot of our work beyond just the transportation plan. So hoping that we can take this away and apply it in other research and apply it in other projects and things that you might lead as well. So we thought we'd there was a question that keeps coming up around like, why would we go to Helsinki and do this? And one of the first things is that it's definitely not a copy and paste approach. Obviously, we know there's huge differences in the context and the population, and so that has to be considered. But there are a few really key reasons why Helsinki has kind of been like a shining star, not just like for Northern Circumpolar, but actually globally. For the last 8 years and counting, Helsinki has been rated the happiest, Finland has been rated the happiest country in the world based on the World Happiness Report. And that's been attributed to the strong connection with nature and land, the strong social supports, and the high level of trusting in society. And also while we were there, we did really observe kind of the high level of trust in government as well. So it wasn't only in the society that was shared, it was in government. They are a global leader in evidence-based city planning. And what was very clear is that they really embody the strong Scandinavian social values as part of their design. They integrate really smart planning tools, and they have a culture that accepts co-design as a way of planning, designing, implementing, and learning. So we'll talk a little bit more about that. There's also long-term political will for this work. So it's not just based on, cycles of government. It is a long-term kind of commitment that's been made as a society and as part of their organizational culture. They are also willing to take really bold policy action to advance social equity, and they have the support of communities to do that. So they have very expansive housing policies that are recognized around the world that we had a chance to learn from. They have climate adaptive street designs, data-driven urban development, and they are attempting always to center equity and accessibility. And we did see some of their challenges as well with this. It wasn't all like a rosy picture. And so there's also like similar challenges that we have to consider here. I thought it was interesting that in a recent publication, Dr. David Suzuki actually referred to the Finnish government and what they're doing as part of considering climate adaptation, knowing that we really have to focus on climate adaptation as governments and organizations going forward, because climate change is, at a certain point irreversible. And he mentioned that the units of survival are going to be local communities, and specifically reference what Finland is doing to support and their citizens to prepare for the likely long-term impacts of climate change. So we'll just do a brief overview of some of the study tour and the sites and people we got to meet in case that's of interest to folks. The first day we were in Helsinki, we got to do a walking tour of the city center and learn about the different, kind of the background and context for the population there, what's informed it, proximity to other countries and geography and how that's impacted them. We visited the Helsinki city center and had presentations there, as well as visiting the Hotıì Public Library, and that's the picture in there. It can't even capture the scope of this public library, but they invested in a co-design process with very comprehensive public participation in the design of this library as a community space. So it wasn't just a place to house books, it's actually a place to come together as community. And the majority of it, actually like entire floors of the space, are oriented to providing people access to instruments, to like different crafts and equipment. And we have similar examples of this in Yellowknife, for instance, in Makerspace, but they had this all in this one community center. And people, when we went there, were just like going there, hanging out, would spend like half the day there. And it was really a nurturing community environment where different people came together in a shared space. On day two, visited the Helsinki City Municipal Government. We also got to tour the Ruoholahti playground, and that's in the picture there. And they also take a very intentional approach to playground design. This one was designed based on like a computer model, and so children would have the opportunity to learn about computers at the same time as playing. It was designed for children of all ages and also included family spaces where like family members could also be seated and engage in community. The playground also provided free lunches for children that were in the community around that area, and that continued throughout the summer. Later that day, we got to visit what's called the Jätkäsaari neighborhood. This was part of learning about their Housing First initiative and the amazing approach they've taken to address the issue around homelessness and supporting unhoused people in Helsinki. The Jätkäsaari neighborhood is actually in the picture there. There's a number of housing developments in the area, and this one in particular was an intergenerational living complex with shared community spaces. So we had like families and students together with elderly and seniors, and it was really interesting. One of the things they had mentioned is the students could offset their room and board by volunteering and supporting the seniors and elders in that same complex. So it was a really interesting way of building community and social connection. On day 3, we were able to visit what's called the Urban Environment House, which it houses the city's Urban Environment Division and the Chief Design Officer, which is like a pretty foundational, well-recognized role globally to have a chief design officer for a country. And so they shared how they go through co-design, how they design and embed urban policy and urbanism in how they understand what is needed, and that it's really grounded in the experience of residents. We also I forgot to mention, like from day 1, we were assigned bicycles. So this wasn't just like a study tour where we were like visiting spaces and being in buildings. We were actually, it was an embodied experience where we were experiencing how people interacted with the environment by doing it ourselves. So we would be walking everywhere, we biked as well, and just saw the fluidity of how easy it was to move from place to place, and not only how easy, but how safe it was, and how the city was really planned for people versus cars. And so that was always prioritized. So we got to see Helsinki City cycling plan and also experience it. And then we learned about their summer streets project. So this is ways that they activate city streets. So they will shut down components of streets or activate streets with ability for community to come together and participate in different community events. And it considers all populations as part of that. So usually they'll plan it maybe in areas where typically people might not feel safe, or that have become kind of like concrete areas where there's not a lot of community coming together. So they're very intentional on where they plan these activating streets initiatives. On day 4, we went to kind of a vibrant city within the city of Helsinki, called Malmi. So it's a lively and diverse urban hub, and we learned about placemaking and how placemaking can encourage physical activity and the steps they've taken to do that. We also visited an area called Puhos. This is a significant gathering place for people of immigrant backgrounds in Helsinki. And we learned that, like, as Helsinki and Finland itself, they have a strong kind of culture around and social fabric, but they've recently learned how they've kind of excluded voices of newcomers and immigrant populations, and how some of their approaches to planning have actually been more top-down and have been intentionally designed in a way that's caused impacts for immigrant neighborhoods and populations. And so we did a walking tour of a shopping complex that was really driven by some of the immigrant population, and how the gentrification of that neighborhood has negatively impacted that community. So it wasn't all, this is where I referred to, like, it wasn't all rosy. It was really easy to get sucked into kind of the narrative around these other places and how well and they're doing and everything's like perfect, but it's not the case. And we're always having to address different issues and reflect on like when we're not meeting community needs. And then day 5, we continued that conversation around placemaking and what that means in the immigrant population with Dr. Hossam. And we also did finish off with an action planning workshop. So from all the learning that we did over the past days, our teams came together and did a dedicated action planning. During this time, like Rob said, Annika had the chance to go to visit northern cities in Finland, Oulu and Vasa, and learn from them around active transportation and what does it mean, what are the innovative practices they're using in terms of winter transportation. So that was really helpful. So some of our lessons learned are summarized in the next 2 slides, and after this we'll get to kind of like the next steps and a proposed approach. So the lessons learned, first is what was really interesting. When we were in one of the group sessions, someone asked like, how do you communicate this? What's your communication plan? And they're like, we communicate through infrastructure with the public. So like through the design is a way of communicating. And I just thought it was an interesting way of recognizing just how impactful the decisions we make around designing communities actually communicates community values through that, and recognizes when you're really designing for people and their health and well-being. So it was really around designing cities with intentionality and asking the question, are we designing for cars, or are we designing for the health and wellness of children, families, and community members? One of the second key learnings was around human experience is key to designing good cities. So all of the work they did around urban planning and design started with observing people interacting with that environment and how people interacted, what were the gaps, what were the needs. And they also, from there, used the process of co-design. And so co-design makes sure that the people that are most impacted by those decisions are included in the design process. And co-design as a process was very accepted across all organizations and expected by community members for designing and decision-making. So their design, they use to build the smooth functioning city. They use it as a tool to better understand residents' needs, and they see it as an important approach to actually address complex issues from their root versus just having kind of like superficial or incremental changes. Thirdly, was the statement from one of the NGOs we visited that leads some of the Housing First initiatives. And he said that homelessness is a choice. We choose it with our policies. And some of the misconception around active transportation, like we said at the beginning, is that it's just about bikes and getting people on bikes to go from place to place versus cars. And we know that's not true. Active transportation is actually a very holistic understanding of what health and wellness means in communities, and it can't be separated from meeting people's basic needs. So Helsinki's Housing First really moved from a place of emergency response in the form of emergency shelters to more prevention and a full spectrum housing support. So what was really interesting about their model is that they invested so much in infrastructure development for housing, but they also didn't just provide people with housing, they provided them with full spectrum and personalized support services when they moved into these housing initiatives. So they would be surrounded kind of by a circle of care from that point, and they could really engage in like whole health and wellness versus just like you provide a house and expect that everything will change.
Kyla, can I just jump in there?
Yeah.
On the homelessness one in particular, it was awe-inspiring on the numbers they shared. So a city of Helsinki, the city proper has 800,000 people in it. They had 87 people in emergency shelters when we were there. There's more people in emergency shelters in the city of Yellowknife of 20,000 than there was in the entire city of Helsinki. So they're not, the way they're operating their housing first and their models is vastly different than we're doing here, even though we're using the same phrases like housing first. We're not doing it the same way. So that was a big lightning kind of bolt for me, was the goal is to get people out of emergency shelters and get them immediately into supportive housing. I know in NWT that is now starting to happen. They're focusing now on transitional housing units. But we're a bit late to this party, but I'm glad we're getting there. So it is, the problem in Yellowknife has gotten kind of worse. The numbers have gone up in the last couple of years. But if a city of that scale can have that few people in emergency housing and has more supports, then there's no reason we can't do that as well. So that was a big takeaway. It definitely is a choice. So we are choosing how we're operating our homeless and vulnerable population housing units, and it was good to hear that there's other ways of operating. So.
Thanks, Rob. And you might want to jump on in the next one too. But so the other thing we learned about, of course, was active transportation. And because Helsinki and many Finnish cities are also winter cities, we learned about how it is actually possible in all seasons. So Helsinki is a global leader in active transportation, and their commitment to cycling is rooted in broader objectives to reduce like carbon emissions, improve quality of life, and encourage sustainability. But it was clear that they have this down to a science. There are best practices, standards, guidelines, and innovations, and they are so willing to share their learning with other jurisdictions as well. And it was really clear from Annika's work in some of the northern Finnish cities that even down to like the dimensions that support multi-use pathways, the equipment that's needed for snow removal. So there are best practices around that can inform this, so that it is a possibility in urban areas in Yellowknife and beyond. Rob, I'll just pause because I know you have lots of thoughts around this too. So if you want to add anything.
Yeah, thanks. The whole city is essentially designed by an engineer, which is great. They're professionally designed to solve problems. But there's a default mode, like I said, to cars. And when we, say, hey, we want more snow removal, we want better bike paths, you're asking the engineers that have not done this before to do something that is new. And so the default mode is going to be what they're doing already. So this is why it was super valuable having Annika gather those kind of very weedy, like she took scans of serial numbers and model numbers of equipment, like, because learning in a very practical community-based way is like, you can't just say, change this. It's like, we want this to change. Here's how it's changed other places. And here's the specific information you need to kind of implement those things. Not just complaining, which is a default mode for, I get as a city councilor all the time. It's how do we fix it? So this is kind of one of the goals is to provide detailed information on how to actually do the shift that we need to have happen, not just saying we need to do a shift. So that was very, very helpful to have those very weedy bits.
Thanks, Rob. And so the other key takeaway was around this concept of placemaking and the role of like insurgent planning, but also and community activism. And so we know that like planning spaces in multiple areas have become increasingly constrained, kind of like more top down versus organic grassroots. And this has the impact of excluding voices of systemically oppressed communities. And so sometimes what's needed for action is, and what we saw in Helsinki was a concept of insurgent planning or community activism. It was interesting in one area of Helsinki where there is a large unhoused population and a large amount of like substance use is localized in that area. One of the community activists like started planning kind of like summer streets and activating areas in that that region of Helsinki, and later began to work for the city of Helsinki and actually implementing some of these things. And that was the way that like change started to happen. So it's just interesting how to leverage that community level action as a way to challenge dominant power structures. And that leads to the last lesson learned was that like equity as the outcome of this work, and that what we heard from a lot of the organizers and designers there was like starting with the question of with who and for are we designing? Because if we don't answer that, then the rest of the design process or the engagement process will risk excluding people and voices, and who gets to create the story or narrative of the work that needs to happen. So I'll move on to our proposed approach. I'm gonna pause and see if Robbie, you want to take this away, and then I'll take a break from talking.
Basically, it's to try to refocus in Yellowknife in particular, but in general on just how we're designing and how we're building out our community as we go in every way. So physically, policy approaches, when we're getting contractors to do work at the city of Yellowknife, are we make sure it's all aligned together? So, so kind of I think the summary would be designing for kids instead of designing for cars. If a kid can't use the thing that you're designing, your policy or whatever your process you're doing, then it's not good enough. It's not easy enough. So we'd like to build that into our whole process. Is how do we shift that mental space in our city? So. And by doing that, like it's not just policies that shift, it's community health that'll shift. It's kind of the mindset of folks. There's a car culture, which is very ingrained, which is going to be very hard to shift. So you're not going to break it overnight. You have to design it in a way that it's easier to walk, it's easier to bike, it's easier to use transportation. Because right now those things are inconvenient and they don't feel safe. So if we keep designing and building a city that way or a community that way, we can't be shocked when no one's biking or using a bus. So we need to kind of shift that, and that's going to take time. But that's kind of one of the main, summarizing a lot here, but one of the main kind of goals of this project is to try to shift that mental space that way.
Great. Yes, and we also started to name like key groups to engage, but that will continue on the next slide here, where we're starting to, this is really just like proposed next steps. So we're really hoping to have your insight and expertise, and we'll share about some of the group organizing we have planned. But the next phase is really, we wanted to share this learning back with community and make sure that it wasn't just staying within the group that traveled, that there was key learning and that this can be dispersed and distributed across multiple groups. And then like, what is the plan going forward? So we have a plan to share learning with community through connecting with local Indigenous organizations, Indigenous governments. We would like to host focus groups with interested shareholders, public and community organizations, and we're currently tentatively planning a workshop for July 22nd at 6:30. That's tentative. I'll let Becca confirm later on. We would like to present some of this key learning and recommendations back to City Hall more initially, as well as in the final master transportation plan. We're hoping to establish like a public webpage where people can access information about this and share a summary report of the learning back with community as well. So this is just a step towards that. Part of this is, of course, like we want to integrate the concepts of co-design and meaningful community engagement as a way of actually designing recommendations going forward. So we wanted to do this not just by doing engagement, but actually by testing some of the things we learned around activating city streets and placemaking in Helsinki. So we'd love to come together and design what those community seasonal engagement sessions can look like. And we'd like to plan one for like the summer and fall, and then a winter one. This would be an way we can test approaches to activating space and placemaking, but also uses as an opportunity to engage with the community. So we would need to identify the planning needs and assemble a team that could help with that. There's also potential a lot of additional research opportunities that can come from this. So connecting with other researchers that are doing work in similar areas and might be interested in collaborating. And then of course, we also want to use data to inform this work. And so there's some consideration of like counters or trackers to understand like activity levels and people using different spaces so that we can be more intentional about recommendations going forward. So phase 3 and 4, you see the different community engagement sessions we're hoping to plan together. And then ultimately all of these findings would be compiled and recommendations would be shared. One of the avenues is through the master transportation plan, but we know there are many other opportunities. The desired outcomes are also listed here for all of this work in terms of safety and cultural safety, wellness across like public health and planetary health, inclusivity and equity, and then community engagement. So I think that is all from us. We wanted to leave you with this quote from Amanda O'Rourke from 880 Cities, which is one of the teams that really led the study tour in Helsinki, who said that urbanism is a powerful tool for addressing some of the biggest challenges we face, including climate change, loneliness, inequity, and public health. So we're really interested in hearing from you. We've proposed a few questions here, but really just like open up the conversation around what you might have found interesting, what's missing, how you might want to be involved, but anything else we're happy to chat about.
Wow, thank you so much.